Thank you for your statement. I'm now going to go over and give the floor to esteemed forum member Geoffrey Roth to present his report. You have the floor.
Hello. Thank you. Madam Chair, distinguished delegates, Indigenous brothers and sisters, it's my honor today to present to this forum on behalf of myself and the Indigenous Determinants of Health Alliance, our study, which is titled Evaluating International Structures Through the Indigenous Determinants of Health Measurement Instrument, Compliance with the UN Declaration on the Rights of Indigenous Peoples and Cultural Safety. We see this as a best practice for the UN system and member states to implement, to monitor their implementation of the UN Declaration on the Rights of Indigenous People. This work emerges from our collective recognition of indigeneity as a fundamental determinant of health, directly influencing the well-being of Indigenous peoples globally. Our study introduces a groundbreaking measurement instrument designed explicitly to assess the extent to which institutional structures comply with the UN Declaration on the Rights of Indigenous Peoples and embody the principles of cultural safety. This measurement instrument is deeply rooted in two preceding reports, which form its foundational pillars. The first foundational report, Indigenous Determinants of Health in the 2030 Agenda for Sustainable Development in 2023, clearly identified that Indigenous peoples approach health holistically as an equilibrium encompassing spirituality, traditional medicine, biodiversity, and the interconnectedness of all that exists. It underscored that Indigenous determinants of health must be addressed distinctly and separately from a general minority approach. The report recognized 33 interrelated determinants that are grouped into three categories: intergenerational holistic healing, the health of Mother Earth, and decolonizing and re-indigenizing culture. It stressed the urgency of shifting from a Western-centric health paradigm towards one that is inclusive of Indigenous worldviews and experiences. The second foundational report, Improving the Health and Wellness of Indigenous Peoples Globally, Operationalization of the Indigenous Determinants of Health in 2024, advanced these ideas further by providing actionable framework for United Nations entities and member states. It called for recognizing indigeneity itself as an overarching determinant of health and emphasized the necessity of Indigenous leadership in health research, policymaking, and operational practices. This report also strongly advocated for Indigenous peoples' rights to self-determination, data sovereignty, and meaningful representation within institutional structures. Crucially, it urged entities to establish mechanisms ensuring compliance with principles of free, prior, and informed consent. Building upon these pivotal reports, our current study introduces a comprehensive evaluative tool aimed at transforming commitments into measurable actions. It allows Indigenous leaders, policymakers, and global institutions to clearly gauge their compliance with the UN Declaration on the Rights of Indigenous People and evaluate their culturally safety practices. To conclude, we respectfully call upon my colleagues on the United Nations Permanent Forum on Indigenous Issues to recommend that UN agencies and mechanisms adopt this instrument internally to evaluate and improve their compliance with the Indigenous Determinants of Health and the UN Declaration on the Rights of Indigenous People. Furthermore, we extend a sincere invitation and call to Indigenous leaders worldwide to partner with the Indigenous Determinants of Health Alliance. Together, we can evaluate and validate Indigenous serving institutions, agencies, and entities globally, ensuring genuine accountability and transformative progress. I'd like to thank the 35 Indigenous advocates, researchers, and leaders that make up the Indigenous Determinants of Health from all 7 sociocultural regions, and especially thank Dr. Allison Kelleher from Snow Creek Medicines and Dr. Jamie Barges from One Fire Associates for their expert assistance in evaluation methodology and for helping to make sure this study was a reality. Please join the Indigenous Determinants of Health Alliance, the National Indian Health Board, the World Federation of Public Health Associations, the Aramat Project, the Coquel Tribe of Oregon, and the Ban Ki-moon Foundation to celebrate and discuss this evaluation tool Thursday from 4:30 to 5:30 in Conference Room 5. There are individuals in the back with flyers. Thank you, Madam Chair.
I thank Mr. Roth for introducing that study. Thank you.